So the first thing that I want to look at Mr. Jones's chart is his vitals. I want to make sure that his blood pressure, heart rate, respiratory rate, and O2 saturation is all okay while he's stationary in bed before we even get him up, because if it's not okay while stationary, all those numbers are going to increase once we have him up and moving. And that way we also have a baseline to see if anything spikes too high or decreases too low, too fast. I'd also want to look in his chart to see if he has any movement or activity precautions given to him by his MD. If he's got like a bed mobility precaution, then I want to make sure that we maintain the bed mobility before getting him up and moving, even though they do want to get him up and moving early. I also want to look at his medication to see if he was given anything to increase his sedation, because that would make it difficult to have him up and moving early if he was just given that. And then also, because he has been on bed rest for a few days, getting up and moving is going to be uncomfortable for him. So I want to see if they gave him any kind of pain medication before the therapy that could help with the movement and help kind of take away some of that discomfort that he may have. Also, any medication that was given to him recently that has any side effects of the orthostatic hypotension or dizziness or nausea or any kind of thing that would make him confused, that would be important to keep in mind. I would also want to look in this chart to see if he has any lines, leads, and tubes that I need to be aware at, and just having an idea before going in and seeing the patient to make sure that he has everything's connected and everything, and then also talk to the nurse or see if it's in his chart of what can be discharged for a therapy session and what needs to make sure it stays in. And then the last thing I'd want to look at is his supplemental oxygen from his chart to see what settings they already have it on. He's on a vent, so we know that, so I want to be careful with the vent. I want to get him up on the side of the vent, but I also want to know how much oxygen he's getting, his FiO2, his pulse ox, and look at his PaO2 and his PaCO2 to make sure that he's getting the required, what he needs, what his body needs for oxygen, make sure that he's not getting too much or too little. And then when we move him, if his supplemental oxygen is at a range that it's okay to increase it. If it's only at 80%, it may be a little difficult to increase it more, because you don't want to go to 100%, but also when they start exercising, there's a chance that you're going to have to increase his supplemental O2. So those are the 5 things that I'd want to get from his chart before seeing the patient.